Hi, this is Dr. Dwain Woode from Diabetes and Endocrine Wellness Center and the Light Away in Huntsville, Alabama. This week I got my COVID-19 vaccine, and I'm going to show you that video here in a little bit and answer some of your questions as it relates to the COVID-19 vaccine. So let's go ahead and get started. This past week on Wednesday, I got my first dose of the COVID-19 vaccine. I actually got the Moderna one, and I'm set to get my next dose in about 28 days, almost a month from that time. So I'm going to show you that video here in a little bit, and I also want to go ahead and answer some questions that I've been hearing that patients have been asking. So I've got those here. We'll go through those, probably about 4 or 5 important questions that we want to answer for you. So here's the video. This is me sitting in the conference room at Crestwood Hospital, which is where I got my Moderna vaccine. And as you see, it actually went pretty well. All right, there it is. I'm going to tell you a little bit more about what happened to me as we get to the end of this, but here are some of the questions. So the first question is, what is an mRNA virus vaccine? And the mRNA vaccine uses mRNA as a blueprint for your body to build proteins that then will fight against the COVID-19 virus should your body come in contact with it. It does not have any of the SARS-CoV-2 virus in it. It is just the mRNA that has the blueprint that will help the body's immune system. All right, that's the first question. The second question is, what should I mention or what should I talk to my doctor about before I get the vaccine? And you want to make sure that your doctor knows all of your medical conditions, right? You want to tell them about any allergies that you may have, any reactions you've had in the past to vaccines, whether it's the flu vaccine or others. You want to talk to them about whether you have hay fever. Are you on any blood thinners? Are you pregnant at the time or planning to become pregnant? Are you breastfeeding? Have you had another COVID vaccine? In other words, have you had, for instance, the Moderna and then now are getting the Pfizer and vice versa? So that's a conversation you want to have with your physician or the folks that are administering the virus. That's very important because we want to make sure that we take everything into consideration as you are getting that vaccine. The next question, what are the risks of the COVID-19 vaccine? All right, and these come in 2 different flavors. One would be injection site issues. That is tenderness in the area, redness in the area, swelling of lymph nodes in that area. Those would be physical things that you could see, and then kind of generalized complaints that you may have as well, including fatigue or malaise, fever, joint aches, joint tenderness, headaches, muscle pain. Those are all constitutional or systemic things that you may see should you have the virus vaccine. And you want to make sure that you alert your healthcare provider and the office that is administering those vaccines for you. Will the vaccine give me COVID-19? And the answer to that is no. As we mentioned earlier, the mRNA virus does not contain any of the SARS-CoV-2 virus, or COVID-19 as it's called. There's no virus component in it. It is just the mRNA that provides a blueprint, if you will, for the body to then generate those proteins that then provide protection for you. So there is no uh, opportunity for you to get the COVID-19 virus from the currently available vaccines. How is the COVID-19 vaccine given? Right now, there are two on the market, the Moderna and the Pfizer, and they're both given in 2 doses. Both are intramuscular, and the Pfizer is given the first dose and then the second dose 3 weeks later. The Moderna is given the first dose and then the second dose is given in 30 days. So that's how they're administered currently. Just a point there, as more and more vaccines are available, that may change. For instance, I think there's one that's being developed or researched that may be a single dose, and the timing for those that may come out that have multiple doses, the timing may change depending on those particular vaccines. So who should not get the vaccine? Anyone that's had an allergy or allergic reaction to a component of the vaccine, or anyone that has had a reaction to the first dose of the vaccine. Those people should not continue the sequence, and if you've had any reaction to a component, you should not get the vaccine. Once again, talk with your primary care physician and the offices that may be administering your vaccine. Who is paying for the vaccine? This is a pretty good question. So currently, the vaccines that are purchased by the U.S. with taxpayer dollars, those are given to the public without a charge, without cost. Of course, check with the location that you were getting your vaccine to verify that. But if it was purchased with U.S. taxpayer dollars, then those are being given to the public free of charge. And then finally, an important question, which lasts longer? So immunity from a COVID-19 infection or protection from the COVID-19 vaccine. So currently, we have not seen enough data to know how long the vaccine will be protective. And we believe that should someone contract the COVID-19 virus, that the immunity is about 90 days. Once again, it's a new virus. We are still learning about it, but those are our current thoughts. About 90 days protection from actually having an infection, and we're still learning about the protection that we will get should you get the COVID-19 vaccine. So for me, back to my story, so I got my vaccine on Wednesday of last week, and I did have some tenderness in the shoulder, and that lasted up until probably about 3 days later. And I did not have any fevers, I did not have any generalized malaise, and did not have any joint aches or joint pains. So far, I've done well with the first dose. I'm scheduled to get the second dose, as I mentioned, about 28 days from the time I got the first one. So I'll alert you guys, let you guys know how things are going. So hey, if you've had the vaccine, whether the first or the second dose, drop us a line. Let us know in the comments. Did you get the Pfizer? Did you get the Moderna? Were you having any symptoms, any pain, any tenderness? Just keep us updated on what's going on. Also, if you've not subscribed already, please do so. If you like what you're hearing and like what you're seeing, subscribe to our channel, hit the bell, and you'll be alerted when new content comes available. Also in the comment, let us know what types of things you would like to hear, what types of things you'd like us to talk about, and we'll see if we can get those for you. This is Dr. Dwain Woode from Diabetes and Endocrine Wellness Center and The Light Away, educating the public for a better you.